We have the elastic spacers and we have the brass wires. For this tray, the setup would be the air water syringe tip, the saliva ejector, the HVE, our basic setup, which is your Mirror, Explorer, cotton pliers, also a scaler, your ligature pin cutter. We have your condenser, and this would be to condense any wires down so it doesn't poke the patient. We also have your elastic separating pliers. We have your Matthews pliers, which places, which twists the brass wire. So we would need that, depending on what spacers we would need, depending on which pliers we would need. 2 weeks later, the patient comes back. This is where we're talking about, 5 to 7 days. 5 to 7 days later, they come back for cementation and bonding, okay? From here to here is cementation and bonding. The first thing that we're going to do is we're going to set up the tray. It's going to be HVAE, our disposables, saliva ejector, air water syringe, our basic setup. Then we're going to clean the teeth with non-fluoridated pumice. Okay, we're going to make sure that these are all cleaned up. We have the Explorer. The Explorer can remove any elastics that are in the patient's mouth. We clean the teeth very well because we don't want to put a band. These are the bands. And we're going to do the bands tomorrow. We're actually going to cement bands. The band is placed around the tooth, just like this. It fits like a ring. Okay, so it fits very tight like a ring around a tooth. This is a band contouring pliers. This is used to contour the band. It's used to contour the band. So the part that's kind of rounded would go inside the band because you want the band to fit right around it, okay? Around the tooth, so it's really nice. So you kind of contour it in a little bit. Contouring means to like bend and shape towards the tooth, okay? So this is a contouring plier. This is a band removing plier. This band removes the band from the tooth. So you would place the plastic part onto the occlusal surface, and then you would be able to remove the band. Okay, so this is a band removing plier. The kind of cement we're going to use is ortho glass ionomer cement. We would then mix the cement to place the band on the tooth. So the tooth is stabilized and cemented onto the tooth. This is what we call a band pusher. What this does is this pushes the band onto the tooth. Since we want it so tight around the tooth, we're going to need some extra force. So we use this. This is a band pushing plier. This is what they call a bite stick. This is in case we've tried to push the band on, but we just cannot. We would then have the patient bite down really, really hard, and that bite stick, they would bite on the bite stick, and it would push the band up around the tissue, around the tooth. This is an orthodontic scaler. This orthodontic scaler has a band pusher and a scaler on both ends. In ortho, you will see this particular type of scaler a lot. This is just a regular scaler. Again, it's hard at the ends. It's not like an Explorer, but it has a pointy, sharp area. These are used to position or to remove the cement off of the bracket. Okay. Then, after we have the band cemented on the patient, we are then going to use a lip retractor to place the brackets. The brackets are bonded onto the teeth. So we would first place etch onto the tooth, which cleans the tooth very, very well. This is phosphoric acid. So it removes any smear layer or inhibition or biofilm from the tooth. It's making the tooth very porous. Okay. After we clean the teeth, we're then going to apply bonding agent. This is an A and B type of bonding agent. And then we would place like a little bit of glue material to place it onto the actual bracket. This is a bracket holder. This holds the bracket. So this is done so it can hold the bracket. Okay, so the bracket's held like that, with the mesh part being towards the tooth. So after you place the material or the glue that's going to stick onto the tooth, then the doctor can place the bracket onto the tooth like this. Does that make sense? Mm-hmm. Okay, so that's an anterior bracket holder. This is a posterior bracket holder. because we do have some brackets that go on the posterior side of the tooth. This would be considered a posterior bracket holder. So this particular bracket holder holds these posterior brackets. Posterior meaning the teeth behind, the back teeth. This is called a Boone gauge. This is used to measure the height of how the bracket's going to measure from the incisal edge. Okay, so after you place the bracket onto the tooth, the doctor is then going to make sure that it's the appropriate height from the incisal surface. If not, they will manipulate it by using a scaler. They'll light cure it, and that'll be done. They'll place all the brackets onto the tooth. This is a bracket placement card. Again, a Boone gauge, an anterior bracket holder, a posterior bracket holder. This is called a micro brush for the bonding agent, the acid etch, and the lip retractors. After we're done with bonding everything on the tooth, now we need to place a wire onto, and we'll be doing this too. We'll have to place a wire onto the brackets. This wire is a space age fantastic wire. This wire I can bend any which way and it still goes back to its same shape. Amazing. Back when I was doing ortho, the doctor would use a stainless steel wire. What started happening back then was teeth were moved too aggressively and the roots started to resort. So even adult teeth would have tiny, tiny little roots because they were moving the teeth too fast. That's when we've evolved and we came out with what they call Nai-Tai wire. Okay? And this has memory, a fantastic memory where it just goes back to the same shape even no matter how much you bend it. There's good and bad because you don't want everybody to have the same smile. So there's good and bad to this wire. But this is the Nai-Tai wire. They come in different gauges and sizes. This is the starting wire. It's very, very light. This is a marking pen or a marking wire. This marks the wire. Like, for example, if you're going to place this wire into the brackets and it's sticking out the edge, you could mark that wire right there and so you know where to cut it. Or this can be used for the doctor to bend the wire. So these pliers are used for bending the wire. This is a tweed loop plier. This is done to make loops into the wire. Okay, it does exactly what the name is. So it makes different types of loops. I could do it all the way around, but it makes loops. And you can see on it, it has like a big kind of like loopy area on this edge. This is a 3-prong plier. It's exactly what it looks like. It has 3 prongs. This also makes bends in the wire. This is a bird beak. We used it. It manipulates and makes bends in the wire. This is a Howe plier. This holds the wire as you're placing the wire into the patient's mouth. So you would hold the wire with this Howe plier. You could also hold this wire with what they call a wine guard. You will see either one of these, they both do the same function. They hold the wire into the mouth. Okay? This is a distal end cutting plier. You're going to place the wire into the patient's mouth. What it means is exactly what it does. You're cutting the distal end of the wire. Okay? Because it's flat and it's going towards the distal. And then we have your ligature pin cutter. It cuts light wires. This cuts heavy wires. This cuts light wires. This is the Matthew plier. The Matthew plier will then place the ligatures. You're going to have different types of ligatures, or to tie in. Ligature means to tie in. So what we're going to do is you're going to have either plastic ligatures, or you have wire ligatures, or you're going to have a chain. So these are different types of ligatures that you would be placing into tie in the wire, because ligature means to tie. Okay, this is a Matthews hemostat. Then we have a ligature director. What this does is this directs light wires. Or we have a condenser. This condenser pushes down light wires. At that time, the patient has all of their brackets and all their hardware into their mouth. We're going to give them directions, home care directions, which is how to floss using floss threaders, or if they need wax, if there's any areas that are poking them, you can place the wax in that particular area. Then if they're using any kind of elastics, then at that time they would get instructions about how to wear their elastics. 24 months or 3 years later, depending on what the treatment plan was, the patient comes back, changes wires, and that's their treatment plan. But to remove the hardware, this is the tray. So now we're at the removing the hardware. We have our disposables. This is air water syringe. This is saliva ejector, HBE. You have your basic setup as we've had on every tray. We also have, this is what a bracket removing anterior plier. So it's an anterior bracket removing plier. How this works is it grabs the bracket right on the anterior portion of the tooth, just like that, and it removes it, okay? And it just kind of like clicks and it pops off. It pops off very easily. This is a posterior bracket removing plier. It would go on the posterior tooth, and again, clip, and just it comes right out. Then we would clean the teeth. We have a scaler in case there's excess cement. We would clean the teeth with fluoridated pumice, making sure they're shining very bright. We would take impressions, and a week later we would deliver their retainers. For their retainers and their home care instructions, we're going to tell them, make sure you wear it all the time. Your teeth will move if they do not wear it. They need to brush it in cold water, making sure that they do it really well. They can place it in Effordent if it starts to get smell. When they go out to eat, they are to place it in their case and not to place it in any not toilet paper, in your napkins, because of possibility of them throwing it away.
I threw mine away.
Did you throw yours away? Okay.
Mine too.
So that can happen, yes, and it happens frequently. So we need to make sure we let them know that as well. Okay, and there's different colors here and whatnot. So, and that's all.
Ta-da!